Hello and welcome to my website. You probably found this website because you or someone you know or care about is suffering from thyroid conditions, and more than likely they're getting treated, and that's how they know they have a thyroid problem, but yet their symptoms still continue. Well, my name is Dr. Richardet, and I'm a chiropractor here in Wilmington, North Carolina, and I've been helping people that suffer from thyroid problems since the year 2000. What I'd like to do is explain to you what makes me unique, what makes my treatment unique, and educate you a little bit on the thyroid. Ask a couple questions. Do you continue to struggle with thyroid conditions day in and day out? Let's look at some of the symptoms that people have of hypothyroidism: fatigue, tired, sluggish, cold feet or hands. Do you require excessive amounts of sleep to function? Do you gain weight easily, or even the opposite? You got weight, you work out, you try to do all these things, but you can't lose weight. Do you have infrequent bowel movements? Depressed? Do you suffer from depression? Lack of motivation? Do you suffer from morning headaches that wear off as the day tends to progress? Do you suffer from thinning hair or excessive hair falling out? Do you suffer from dryness of the skin or scalp? And do you suffer from mental sluggishness, kind of the brain fog, the mental fog? Symptoms of hyperthyroidism: suffer from heart palpitations, inward trembling. Do you have increased pulse even at rest? Are you nervous and emotional? Do you suffer from insomnia? Do you suffer from night sweats? Or do you have difficulty gaining weight? Hashimoto's, that's kind of a new terminology people are starting to learn about. It's an autoimmune disorder in which the patient's immune system attacks the thyroid. Patients that suffer from Hashimoto's experience some of all the above symptoms from the hypothyroid list and hyperthyroid list. So a lot of people that have hypothyroidism will say, well, hey, I got heart palpitations, and I'm nervous and emotional, and I suffer from insomnia. So what two are you on? Well, there's a good chance you have Hashimoto's. You don't know until you test. Let's talk about the thyroid gland a bit. The thyroid runs our metabolism. It is the gas pedal of the body. The thyroid hormones have direct effects on most of the organs, including the heart, which beats faster and harder under the influence of increased thyroid hormones. This is why heart problems can often accompany chronic thyroid problems in women, and perhaps why heart problems are more common in women under the age of 50. T3 is the more biological active hormone. It's the more important for cellular function, and in fact most of T4 is 80% of it's converted to T3 in the body's peripheral tissue. So T4 is just a precursor for the more active T3 hormones. When you go and get your TSH, you look at your T4, you look at your T3s, doctors always are worried about the T4 numbers. It's the T3 that the body needs to use to process, to do something with it. Until T4 is broken down to T3, it's actually just there in the system, not being actively used. One of the problems in some thyroid disorders is that you may have trouble converting the T4 to T3 in your tissue. Have you been checked for that? A lot of people will say no, or they say, well, my doctor's ordered a blood test, but they don't know if this has actually been checked for. This can create a deficiency of T3, disrupting the body's ability to properly regulate metabolism, leading to specific symptoms. There are some clinicians that are treating the thyroid conditions with iodine. I do not recommend iodine in the treatment of thyroid conditions. According to renowned thyroid expert Dr. Karazian, author of the book, Why Do I Still Have Thyroid Symptoms? And actually, let me repeat that. This book by Dr. Karazian, I actually handed out to my patients because I want them to learn. I want my patients to be educated. I want them to understand why they have a problem or why they've had all these different treatments and nothing has seemed to work. He's really put it into a book, and like I said, the title of it is Why Do I Still Have Thyroid Symptoms? Using iodine to treat the thyroid conditions is akin to throwing gasoline on a fire. I'm here to tell you that there is new hope. How to finally end your thyroid nightmare. What makes me different from every other doctor you've seen? What we do is, what I try to teach patients is, they'll say, well, you're just a chiropractor. Well, that doesn't mean anything. You've been to endocrinologists, you've been to your primary care, you've been to different specialists, and you still have the problem. If you didn't have a problem, or you didn't know somebody had a problem, you wouldn't be on this website right now. So with that problem is, you've got to ask the proper questions. So what makes it different? How am I able to uncover this and actually get my patients better? We treat you metabolically and neurologically. And the other thing I think I like to stress that I do is very clear is that I treat you as an individual. No two patients are alike. You go to an endocrinologist's office, most patients have very similar conditions, and most patients are getting very similar medicine, yet they're back over and over and over. And no two people can have the exact same symptoms, the exact same problems, and need the exact kind of treatment. Each patient needs to be looked at as an individual problem that needs individual help. So, you're watching this DVD, like I said, because you or someone you know has this problem. I'm here to tell you that when I get into your case, no stone is left unturned. I want to determine the exact cause of your problem. See, on one hand, you have symptoms. On the other hand, you have the cause of the problem. If you treat the symptoms and you try to make that go away, you don't necessarily get the cause. Unfortunately, a lot of doctors will do the blood test and they'll run a standard TSH and they'll find out that your TSH is borderline or it's low. Well, the lab test, the normal ranges are out here. What you have to know about lab tests is there's a functional range. The functional range is a very tight little range inside the middle of that zone. If you're outside of that zone, then you already are starting to have some of these problems. So when doctors treat you with medicines and actually push you into their normal range, you can still continue to have your symptoms because you're not actually in the functional range. Why are you not functioning? Well, those are questions that have to be asked, and that's why I say no stone is left unturned. I want to find out why the exact cause of those problems are. So I'll guarantee you that no one has told you what I'm about to tell you. What makes my program unique? How I successfully treat your thyroid problems. How do I successfully treat thyroid conditions? Specific metabolic and neurological protocols. Specific metabolic testing and treatments. Sensitivity to testing. So one thing we want to test is to see if you're allergic to gluten. So wheat, rye, oats, and barley. Milk, eggs, yeast, and soy. If you're sensitive to any of these foods, it can be making your thyroid condition worse. If your doctor hasn't tested for this, you have no idea if you're actually making the problem worse just with the foods that you're eating. If your thyroid condition is worse, it'll increase inflammation in your brain and throughout your body. If you suffer from Hashimoto's thyroidism, you need to be off all gluten now. So a lot of patients say, well, I've been tested for Hashimoto's. Well, what did your doctor put you on? Well, they put me on Synthroid. Well, that's for your hypothyroid. What about the Hashimoto's? Well, that's what I thought it was for. No, you need a specific treatment for that condition. And one of the first things patients need to do is be off of gluten. All right. Here's some of the symptoms of these sensitivities. Chronic pain or fatigue, frequent indigestion, bloated after eating, frequent loose bowels, constipation, mouth ulcers, or vomit often. The only way to find out if you suffer from any of these sensitivities is to run the proper test. And I'm here to tell you, out of 100 patients I see, maybe 5 have had the proper test to see if this is a condition you have. If you don't know, you can't fix it. You've got to ask the right test. All right, we want to do complete blood panels. So by using specific blood tests, such as a CMP, a complete metabolic panel, a lipid panel, and a CBC, we can assess your adrenal glands, your liver, your kidney, your red white blood cells, your gut function with the above test. All can be affected with chronic health condition. By addressing any problems with your adrenal glands, blood chemistry, or gut function, we can help you heal faster. The CMP also allows us to check your blood glucose level, since glucose and oxygen are needed for the brain to function properly. Now, what other tests for the thyroid are necessary? Well, we want to know about the TSH, the standard, kind of the cardinal test for it. But what we want to know is that the test is in the middle, in the functional range. All right. What does this hormone do? The message is sent from the gland in the brain pituitary to the thyroid. All right. We talked about free T3 and free T4. Important hormone T3 is for producing. That's produced by the thyroid gland, considered to be the more biologically active hormone between T3 and T4. Another important hormone produced by the gland is free T4, and like I said earlier, that gland, that hormone has to be broken down into the active T3 so it can be used. So we want to check those levels and see what's there. All right. We also want to check for what's called the thyroid binding globulin, the TBG. This test measures the amount of proteins in the blood that transport the thyroid hormones. If this is deficient, you can't even transport the hormones properly to get them there. Elevated testosterone can lower the TBG levels, and elevated estrogen can raise them. Both can produce hypothyroid symptoms. Thyroid antibodies, TGB and TPO, checked in suspected cases of autoimmune thyroid. So what are we talking about? Total T4. This reflects on how much total T4 hormone there is in the blood. Free thyroxine index. This is an estimate of how much thyroxine is in the blood. And the resin T3 uptake. This test measures the unsaturated binding sites on the thyroid protein. We want to see how many sites are still available. If they're already saturated and you still have your problem, that's a whole different problem that needs to be addressed. But if we don't ask, if we don't check, we won't even know. If we just run the standard lab test, then we're going to be able to treat you the standard way, and you'll be sitting in front of your computer watching a different video with the same problem. I'm here to tell you, it's my job to change that for you. So we also want to do an adrenal stress index. You can test the adrenal glands with this ASI. This salivary test is much like DNA testing. except that the adrenal glands sit right above the kidneys, and they are our stress organs. So for patients who've been under a lot of stress, they have a very stressful career, stressful household, just stress in general, these are getting worked over and over. If you suffer from insomnia or diabetes, this test is a must. It will measure your cortisol levels. The immune panels, these are very, very important. We talked about Hashimoto's, autoimmune. We want to see what's going on. You can be suffering from an autoimmune condition. Once again, if you haven't been tested, you don't know yet. An autoimmune thyroid is called Hashimoto's thyroiditis. Your immune system could be attacking your thyroid. This is why the immune panels are so important, and not just to the TPO and TGV thyroid. So there are two parts of the immune system, the Th1 and the Th2. The Th1, the helper cells, they're the army. They're the ones that go in, attack, and do the cleanup work afterwards. The Th2 are kind of the messenger antibodies. They're the ones that go and determine and mark things for destruction. And then these come in and clean it up. So what we want to know is if you're dominant on one side or the other. If these things are marking too many good things, too many natural, normal things, these are going to be set to attack regardless. So we've got to figure out if there's a dominance in those two sides. So the T and B lymphocyte natural killer cell panel is important to your testing. A lot of people have heard and are hearing more and more about leaky gut, so let's talk a little bit about what that is. Leaky gut syndrome describes a condition of altered or damaged bowel lining caused by antibiotics, toxins, poor diet, parasites, infection, can lead to increased permeability of the gut wall, to toxins, microbes, undigested food, waste larger. So what does that mean in English? Let's break it down. The gut wall should be really nice and tight. Everything that goes in the stomach, for the most part, should stay in there until it's broken down, processed into small enough molecules, and then it's taken through and passes through. What happens in leaky gut, the cell wall becomes a little open, and bigger molecules are able to pass through than should be. When that happens, your body sees a foreign invader and it starts to attack it. All of a sudden, normal food, normal things that we ingest in our body will start to become attacked. So as soon as our body gets into that, we're kind of in the fight or flight mode. Our body starts to make antigens and starts to destroy it. Every time we do that, our body instantly starts to have a reaction to that. There's a saying called gut on fire, brain on fire. So if the gut's not healthy, the brain's not going to be healthy either. So hormone panels, we can check hormone panels to determine if the patient suffers from low testosterone in males or low estrogen progesterone in females. Symptoms related to decreased hormones, of course, is depression, fatigue, mental fogginess, mood swings, hot flashes, sweating attacks, weight gain, and decreased physical stamina. So specific neurological testing and treatments. One thing we want to do is oxygen. Oxygen is very important to the brain and to the rest of the body, but the brain uses over 20% of all the oxygen we intake has to be used for the brain. What I like to ask patients is where do you picture yourself in the next 1 to 3 years if your condition isn't taken care of soon? A lot of patients watch this video, they've had their condition for years. Maybe 1 year, 5 years, 10 years, 20 years. Maybe it's only been diagnosed 10 years, but you think, man, I've had this for a lot longer before I finally went in. Well, what I ask is where are you at now, where have you been, and where do you think you're going? So what's it worth to you if you can get your life back? If you can truly improve your condition and not have your condition rule your life. You don't think, man, I come home from work and I'm just wore out. I just lay down on the couch, I just want to sleep, I don't want to do anything. I take a 2-hour nap and then I wake up, I can't eat, I don't feel well, I have bowel problems. You start to think, well, I don't want to go over to this party because if my stomach gets me, it'll be embarrassing, or I can't play with the grandkids, I can't play golf, fishing, all these different things. Where do you want to be? What I can tell in patients is I don't know if I can get you better. What I'm going to offer you is a chance to see if I can help you and if you can be helped by my treatment. What I tell patients is the first thing you want to do is call my office, 910-798-5560. You want to speak to Missy or Candy and tell them about your condition. What you want to do is get my packet out to you. I'm going to send you a packet full of pages and information with a whole lot of questions, probably more questions than you've ever answered to a doctor's office in your life. I'm going to have you send those questions back in, along with any old blood work, lab tests, anything you have pertinent to your condition. I want to see all that stuff. Before you and I sit down and talk, I want to have a good understanding of what's going on and to tell you if I think I can help you. The next step is, once I look through all that paperwork, I'm going to have you come on in. We're going to sit down, we're going to talk about your condition, we're going to talk about your past, where you're at, and what I think I can do for you. So what I want you to do is, if you think that this sounds like something that would be good for you, you want to take the next step, call my office, 910-798-5560, and let's get the information out to you to see if we can help you.